Right. Thank you so much for having me here. Great pleasure to be in part of the case examples today. I want to give you an example of how medtech industry is trying to use digital health to improve the value that we give to our clients. And I don't know how much you know about Medtronic. It's not that much important. It's the largest medtech player globally. So you're looking at 30 billion revenue, 85,000 employees approximately. And our core business up until recently has been developing manufacturing and distributing medical devices such as pacemakers, insulin pumps, spine surgery equipment, all kinds of implantable and non-implantable devices. And you would wonder, why I'm talking about patient engagement. So before I dive into why, I want to give you some of the recent published examples on how patient empowerment, patient engagement is surfacing as a topic. If you look at the recent HIMSS eHealth survey for Europe, you can see that, of course, patient centricity again is out there as a topic. And the one thing I was quite interested to see was the fact that Europe-wide patient empowerment and self-management of patients has been seen as a second most important topic or a challenge by the organizations. And the one thing I always keep in mind when we work on these solutions around digital solutions to support our business in Medtronic is if you look at resources in healthcare, everyone is strained. Everyone is used to its full, right? And then there's this one resource which has a lot of time, has in theory a lot of motivation to take care of themselves, and that's the patient, obviously, right? So the one thing that is on my mind constantly is how can we get those patients to do these a number of fairly simple tasks which can have a massive effect on the outcomes of these patients. And I'm not saying patients are not smart. I'm not saying patients cannot do complex tasks. But overall, we can still safely assume that if we provide contextual information to patients, contextual training, if we provide them with tasks on a daily basis, and if we provide the understanding, the motivation behind why this needs to be done, as to this risk factor like weight has a significant impact on your atrial fibrillation outcome. If we provide this context, most of the patients should be able to perform simple tasks, many of which have been shown to have significant impact. And I was thinking a lot about where on the Gartner hype cycle should I put the digital-enabled patient engagement, because I was very much hoping I could place it on the other side of the throw. But honestly, I think we're still at the hype. At least when I'm talking to clients, I see that there's been a massive buildup of hype around understanding that patient engagement is really important. It's happening now. It's not just something it's not just something we see in the decks. It's really happening. But I still think that when we see broad deployment, which I think is happening now, and it's probably going to continue in the next 2 years, when we will see pretty much every hospital deploy a solution in that field, we're probably going to see a bit of a throw when all the promises will not be able to be delivered upon. But still, I think it's not going to be deep. I think it's going to be fairly shallow, because there is a lot of research at the back, and there's a lot of lessons learned from the consumer space, which we are going to and which we are reusing. Now, I'm going to come back now to why Medtronic is doing that. Imagine you are today you are as a hospital or as a trust, you are paid on a number of surgeries you perform, right? So you obviously focus on trying to maximize the number of procedures you perform. Imagine tomorrow you are also paid on patient outcomes, and imagine pain level or mobility of a hip after 1 year is starting to be considered as an outcome, which we see happening in the Scandinavian countries. Suddenly, many other things become important as well, and you start considering them. For Medtronic, as we move from a standard medtech model, which was just produce and sell devices, towards a model in which we need to be much more clear about the value that we provide to the hospitals and how the pricing is going to reflect the value, we also need to start understanding, it's not just about we give you a stent or we give you a pacemaker, but actually we want to make sure that that stent or pacemaker is used to its fullest extent. Because if we are just paid for the pacemaker, we might not care. But the moment our payment becomes dependent on, does the patient continue using the pacemaker? Does the patient have a readmission because the pacemaker was not working properly or because the procedure was not done in the optimal way? Then suddenly we become interested in that as well. And the interesting thing is, obviously then that's why the perioperative context is something that we're very passionate about. And then when you start looking at the profiles and looking for challenges, there's a number of challenges which, once you start looking at the literature, you can see that you can actually resolve with fairly simple means. One example I really like to use is anxiety. We say, yeah, people are anxious, it doesn't matter, we educate them a bit and then they're less anxious. But what does it really matter? There are studies that are showing that if you're an anxious patient, your post-surgical perception of pain is going to significantly increase, right? So if you as a hospital or me as Medtronic are getting paid just on doing the surgery, we might not care. But if we get paid on patient outcomes, suddenly that pain becomes important. And so if I can do something prior to surgery to reduce the perceived pain, why not, right? Especially if it's as simple as providing some digital tools to the patient, providing some simple breathing exercises over digital means, and making sure that the patients perform them, right? So that's on the patient side. There's a number of opportunities. On the physician side, on the nurse side, imagine the amount of time that physicians and nurses spend explaining procedures to patients, right? And I'm not saying it's not important. It is very important. I'm just saying that they could spend their time much better than they are today. And again, a lot of this educational part can be taken and pushed through digital means. And also from the hospital side, what we see when we talk to clients, especially in the private space, is they're extremely interested in ways which allow them to improve the overall patient experience. So it's not just about excellence in the clinical care that you do. Of course, that's always, it's always there. It's always one of the first things that you look at. But they're also saying, well, if we can offer a more holistic experience, if we can give them a sense that they have much more information on what's going to happen, why, when, and how, then that's a value. So, when we started approaching clients a year ago and talking about Get Ready, which is the solution I'm talking about today, we thought, we need to bring all the evidence around the reductions in length of stay, all the potential clinical outcomes that we could build. And then some of these, some of the private clinics, some of the CEOs or CXOs basically come back and say, look, yeah, you will build that evidence. Don't worry, we're gonna get there. What we want to see is we want to use it ASAP because it helps us differentiate on the market, because it gives something to the patients that the others don't have. So it seems like there's a number of these fairly straightforward things which we could resolve as long as there is a solution available. And even on the clinical side, while we don't yet have our own data, there's a lot of research that is showing how prehabilitation and rehabilitation, if you really work on patient engagement, how you can significantly improve a number of these key parameters, right? The length of stay, total cost of care, time to return to normal activity, all kinds of things. Right? So let me play a video on what Get Ready is, and sorry, it's a bit marketing-y, but I think you can forgive me for that. And then let me just try to get this up and running. And we don't have voice for whatever reason. Do we have the gentleman here, technicians that can help, perhaps? So this is here. And I've got.
Let's check your audio settings quickly.
All right. So. We've got the voice here, so the outputs, you can probably check them here as well. That's the one? Yeah, excellent. Great, thanks for that. Yeah. So I think we started from the start, so let me just go back to this slide. And then I need to go back again to the duplicate, and then I can play it. Yeah. Thank you.
This is Sophie. Sophie's life changed recently when she was diagnosed. To manage her condition, her care team has established a treatment plan that includes surgery. It is clinically established that the better the patient's physical, nutritional, and psychological status before surgery, the faster the recovery. In order to prepare for her surgery and to ensure a fast and successful recovery, Sophie's care team enrolled her in the Get Ready program. Get Ready is a solution to support patients in their surgery journey from preparation to recovery at home. It is designed to help Sophie engage in her own care, reduce her anxiety, and benefit from a faster return to usual daily activities. Sophie can engage with the program in 3 different ways. Via the guide, a digital platform accessible from computer, tablet, or smartphone. Via Ariana, the automated coach which will interact with Sophie through messages. Via phone, dedicated experts who will support Sophie through her surgery preparation journey. Get Ready is easy and intuitive to use. All Sophie needs to do is follow Ariana's instructions and reminders, log on regularly to the platform to access knowledge and useful information. In addition to this, experts are available to answer Sophie's questions over the phone and may reach out to her if needed. So, what should Sophie expect? She'll learn tips to prepare for surgery, like eating right, managing stress, and exercising more. She'll learn the little things like what to pack for hospital and how to find the best food she needs. She'll learn about her surgery, her hospital stay, how to manage her pain and recovery process. Once Sophie's surgery is complete, she will continue to use Get Ready to access all of the knowledge she needs and be able to share her recovery status with the care team. Get Ready is designed to help Sophie prepare for a successful surgery, spend less time in the hospital, and quickly return to normal life.
All right, so that's the value proposition, right? And now, how do we actually do it? There's a couple of components that need to be there, and digital is only one of them. And you know, what we've learned so far with all the work on patient engagement is that digital only goes so far, right? So you know, imagine you're receiving reminders every day. It's fine to receive the reminders, but unless you have the motivation yourself, you might not continue acting upon them, right? If it's like 6 o'clock, you need to wake up and go running. It's raining, it's cold. You might do it once. If you don't have that drive, you're not going to do it again. So this is also the reason that from a solution component standpoint, we know that, of course, we need the digital, but we also need other layers. And the key layer to add is the support service, the support center layer, which is basically a call center with trained people, trained nurses that can provide the right amount of, let's say, monitoring. There's a, this little twist of behavior change motivation. If you say to the patient, these are the tasks that you're going to be receiving every day, and then you say, well, if you're going to have trouble following up on those tasks, we might give you a call just to check up on you. That's it's a small thing, but it makes all the difference in terms of patient compliance with the programs. So there's the platform, the support center. There's lightweight implementation support. We're not claiming this to be a full-blown integration type project to our clients, because it would just, they would just say, oh, it's too complex. So we basically say, look, this is a layer. We can do simple integration, but we're not trying to replace your solutions. We're not trying to change your IT strategy or anything. And there's a lot of content at the base. There's a lot of content there, which has many different areas. I'm not going to go into the details, but it's about risk factors, understanding and certification, about change advice on behavior, about anxiety, pain management, and also just about explaining to patients what's going to happen to them. And another important thing when you're creating this kind of solutions where you combine different assets is that you need to keep all loops closed. In our case, we have a chatbot on the digital side. We have a chatbot. We have the standard web app, which renders into any kind of device. And we've got the call center, the support center stuff. These are the three primary channels for our patients to communicate with us, which means we need to make sure that whatever is exchanged and whatever is communicated, that there is it does not get lost. If a patient would send a message to the chatbot, to Ariana, saying, I've got I've got a very strong pain in my abdomen, we need to make sure that doesn't, get lost somewhere. Or, our chatbot saying, oh, I didn't understand the message. That would be too bad. But apart from that, the structure is pretty straightforward. I think if you've seen one of these, you've probably seen them all. So I mentioned the chatbot. This is something that we believe is going to be key in allowing us to operate at a cost which we can translate into a price to our clients, which suddenly makes this kind of solution attractive. Because the issue with operating any kind of solutions with call centers is that the cost can be very prohibitive. And then what we want to avoid is our clients thinking, our hospitals and trusts thinking, yeah, should I put this patient on this service or not? Right? We want to avoid it. The point of this solution is that it should be used generically across as many patients as you can, which is why we needed to innovate as much as we can on the cost side in order to make it affordable. So we've got the app, we've got the instant messages, and then we've got the full-blown experience with all the structure, with all the content access for the patients. And the point is that there is integration, there is understanding between what the chatbot does versus what the app does. So if today I need to do my breathing exercises, and my Ariana chatbot sends me a message saying, oh, today you need to do the breathing exercises, can you confirm? And I confirm. The app, when I go to the app will know that I have done my breathing exercises. Otherwise, the whole thing would be fairly pointless. There is, of course, all the necessary patient kind of management, visualization, dashboards that are needed by our nurses to monitor those patients. And the one important thing, which also creates a lot of value for the hospitals, for the trusts, is the fact that suddenly you have a very deep understanding of what happens with the patients from the first day that a surgery was confirmed, that they were onboarded on Get Ready, way up after discharge, right? Because the point is you're running this program. If it's an elective surgery, you run it as soon as you know the date of the surgery, you start educating the patients. And you finish once you have collected all the relevant patient-reported outcomes, and once you've finished all the, let's say, transition out of hospital activities or the rehabilitation activities that were needed to be performed. And suddenly, we start having a very granular understanding of the patient behavior over time, the engagement with the system, and we know what the intervention was, we know what the risk factors are, we know how the patient behaved over time, and we know the outcomes, at least on the patient side. And this is something that the hospitals, that's where the clinicians, when you explain that to them, they start seeing all that value. And there's massive value for us as well, because in order to improve the service, we can keep coming back, analyzing the patients, the different patient cohorts, how they behave, how they interact with the system, depending on the risk factors. Do they address those risk factors or not, and what the outcomes are? So we can start having a much deeper understanding into this interplay. And of course, it sounds counterintuitive, but this solution which we are providing is not a Medtronic-specific solution, right? It would make little sense to go to a client and say, yeah, you can only use this for patients where you have implanted the Medtronic pacemaker or something, right? So the point here is that, yes, of course we always want to sell more of our devices, but we approach our clients and say, look, this is a solution that you can use across your core clinical areas, and it's not device specific. You can use it on any other surgery where you use competitive products as well. The one thing that, and I'm now going to start talking a bit about our experience and how we leverage openEHR and how we leverage the ThinkAir platform, is how can we make sure that we are able to scale this at a very reasonable cost. And some of these things, one of the key things is the pathways, right? So first of all, the solution needs to be specific to procedures. And then you need to add for variability over countries. You need to add for variability over hospitals. So there is a need for very robust management of the processes, of the data, otherwise the costs would just explode as we scale and as we deploy across countries. And this was, some of the guiding principles. And again, I'm not a technical person, so but I want to talk about what the business requirements are and how, at least I see them translated into the IT requirements. What we see is clearly that our clients want to avoid data and solution lock-in, right? Especially UK, I think, is a market where this awareness is quite strong, but we've seen that in other markets as well. So having a solution that provides an open data model that is vendor neutral, has a vendor neutral archive or the ability to move data from one solution to another rings a bell. Same goes for us. We as Medtronic, the way we're developing this solution is not by just contracting one single vendor that would give us the whole stack. Because in the past, we've had very bad experience with that. The moment you start paying someone to do something for you, the moment they know they are the only ones for you, you have no power to negotiate anymore. So what we've done in this case is, again, leveraging the approach to set up a little ecosystem. We're not building a 100 supplier ecosystem because we don't need it today, but we're setting it up so that we could if we wanted to. So today we've got 6 partners providing different components of the solution. And while we have no intention to replace them today, we at least have the ability to replace them if they started to pull some supplier power on us. The approach using the openEHR layer also allows us to innovate much quicker, because now we can go to an interesting company that has an interesting solution, and we can say, okay, you want to test with us, and usually they would be quite interested, and we would just say, look, there's the sandbox, integrate, and we can do some quick tests on the market, and we see how it goes with little investment, with little risks. The one thing which is also very important for Medtronic is, as we are moving to these new business models around paying attention to the outcomes as well, not just at having the best products, we need to start collecting the outcome data. And what we can then also provide is various support for benchmarking. And whenever you talk about comparing and benchmarking, you need data consistency. And here, again, the semantic and the ontologic consistency is key. And the approach that we're using, we believe, is the one which makes most sense. And obviously, as I mentioned before, in order for us to truly contribute to develop new knowledge around understanding, this type of patients with the same surgery, we will have a different outcome because for some or other reason, they are not doing the breathing exercises, or for some or other reason, they are detaching immediately after surgery. These are the things which we need to explore, and for that, again, we need to have access to as much structured data as we can so that we can mine it and get those insights. Just the last slide on what have we learned so far. When we launched this project together with Marant and the other partners, yes, we had to develop some new content in openEHR. That went pretty smooth. Some of the new partners which we brought on board were not aware of openEHR before. So, we had the support of Marant to do the trainings, to bring them on board. And I think there was still a little bit of, there was challenges which we received as to, today we do our things this way, why should we do things differently? And again, in our case, it was just, that's how you need to do things because this is how we are doing things. We've seen them taking on, understanding what they need to do, and they followed. And the more awareness we have, the easier it's going to be to reduce this barrier as well. The openEHR, the openEHR approach to clients, we've seen it's been very beneficial. As long as they have people who understand these issues, they will immediately say, okay, I get it. This makes complete sense. We know as well that while it takes us a bit more effort to do it right, like Tomáš also shown the example of how do you move to the postmodern, so we can start with one app, but you do it the right way. We had that same thinking. Yes, it was slightly more complex. It did take more effort, but we know that from this moment on, things are going to be going much faster and much less risky. And we've got the standard concerns from clients around GDPR, around data processor, data controller, access to data, and here we're very clear. We're data processor, you're the data controller, we just process for you what you tell us to do, etc. And for us, the next thing, as I mentioned, we're very much looking to the work done by Thomas and by Tomáš's team on the process management, because we want to, as soon as possible, get that and include that layer into the solution properly. And as I mentioned before, start learning around the interplay between what we do, what the hospitals do, and what the outcome for the patients is. And we just had this interesting feedback from one of our key opinion leaders who we presented this solution to, and he said, this is amazing, just on the first meeting with the patient, I can save 20 minutes. So I'm very much looking forward to the rest of this, and hopefully in a year I can come back with some tangible data as well. So thanks. Yeah.
So any questions for Matic? John?
John Meredith, NHS Wales Informatics Service. What I find really interesting is that you're approaching an openEHR platform in the same way that I would. I was working as part of a national program. But obviously, one of the key selling points with openEHR is vendor neutrality, and you're a vendor. Are you going to still subscribe to that, that concept? And then also, how do you plan on managing the individual archetypes and templates with, potentially a national program or a hospital that may already have these?
Yeah, I think we get the question around. Well, I think it's a trust issue, right? So our clients, the hospitals, are kind of not sure why we're trying to do it this way, right? But at the same time, Medtronic, we are not a software vendor ourselves, right? This is not the core of what we do. And we are not trying to become a software vendor today. But what we want to do is we need these kind of solutions, right? It is becoming more and more core to us. We don't have the core capabilities to do it ourselves, right? But we need to bring these solutions on board. So for us, it becomes very important to do it in the right way. Because as I mentioned before, we've had some bad experience bringing on board vendors who would provide the full stack, and then a year down the road, after we invested significant amount into them applying the solution to our needs, right? Creating new IP, but still keeping some of their own IP for themselves, right? Because it was there before. And then we suddenly said, okay, so, that's not working for us because we became locked to them. So we are actually facing a similar issue as a trust would be facing, right? Because we're the ones combining various assets and capabilities to build a full stack solution, which we then introduce to the hospital. This is, I think, the first part of the answer. And the second one around the archetypes. I see there's two layers of traditional medtech. One is related to the devices which we produce, which are getting more and more smart. And there you see a very tightly controlled ecosystem around and the data models, right? So most of the companies are trying to hold on to the proprietary data models around the device-generated data. Because it is a source of created value, and it is a source for the potential future revenues as well. So, but that's not what we are working on. What we see is on the patient management, on the patient engagement, patient care coordination side, you cannot play in that way. You can only play in a very open, transparent way on the data models and on the process models. So for us, it's not a question. So whatever we do with intent to be as open because we will benefit from the openness, right, in this particular case.
Ian Thompson, I'm a GP in Scotland and EHR advisor. You talked there about using this to support the patient pathway through an inpatient stay. Can you see a similar approach to patient-related outcomes being used to nudge people along lifestyle choices for chronic disease management?
Yeah, this is a very relevant question, and today I've not talked about it just because of the constraints of the time and just keeping the focus. But we're developing the same approach also for long-term situations. And I'll give you an example. We produce insulin pumps for patients with diabetes. And what we see is there's a massive opportunity to apply the same concept for patient onboarding onto complex therapies, right? Where they need to understand exactly how to operate a particular thing. Same would go for biologics, where some of them are self-injectable. You need to train them, you need to educate them how to do the self-injections, right? So there is a certain level of onboarding, and then you need to ensure a continuous behavior to use a particular solution, like a particular pump or a particular injection to re-inject. So that's one layer. And the other layer which we see is, and I'll give you the example of AF ablation, so atrial fibrillation. We are already, the program does not stop after a couple of weeks post the ablation, right? But it continues at least for a year. Because what we know is that risk factor modification in AF is critical. So if you just do ablation and then you just let patients go and you do whatever you want, pretty much 40% of them will come back in a year for another ablation. If you, however, tell them you need to lose weight, you need to exercise more, you need to eat better, and some other things around, control of blood pressure, you can reduce the repeat of the AF significantly. So yeah, we are already building those programs into the solution.
Rupert Vaudry, a sort of retired consultant gynecologist and concerned with maternity clinical records. At what point do you think we'll have some evidence on the proper scientific evidence-based medicine that this is actually improving healthcare, particularly in view of the recent papers being published showing actually that a lot of the attempts to go electronic have actually been detrimental? And certainly my records are in 26 incompatible systems. At what point do you think actually anything will be unified apart from what I know about myself?
I think that's a question that goes beyond my ability to answer, especially the last part. I would agree in part with you in terms of not all digital has been good, right? Specifically on patient engagement, we are working on building our own evidence as soon as we can, because it's quite central to us to be able to say not just, oh, we think this is nice and good, but also to say when this is why. There is growing evidence also in the field. We're not the only ones doing this. There's other players doing it as well. They've got research. We're closely following that. It makes sense. That's also why we continue moving in this space. I see two levels of evidence creation. One is the non-clinical, which is really more about patient experience, patient engagement overall, and the activation scores. That's one where we don't necessarily need to do massive clinical trials. And then, of course, the other dimension is the proper clinical evidence on length of stay impact, on readmission impact, and on other clinical outcomes. And for that, we will need to do proper clinical trials to prove them. So there's not a simple answer. We're working on that, and the industry is also working on that. And when it comes to bringing everything together, we as a company have a view on that, how this should be done, and we are working towards that because we know that in order to get to what, to this holy grail of value-based healthcare, we will need to understand what's the patient-reported outcome, what's the clinical outcome, what was the intervention, what were the underlying risk factors that were contributing to this. So, yes, we need to bring it together, and the reason why we are all here today, I guess, is because we think that this might actually work, the approach that we're taking.
Thank you, Matic. Unfortunately, can we take this offline because we're going to eat up our break? So
we're going to eat up our lunch.
Well, not the lunch. Luckily, not the lunch. So we will reconvene in about 20-25 minutes and continue with the program. Thank you.